That's a common question I get from friends and family and even patients. And the answer is not necessarily. I would advise you to discuss it with your primary care provider first. Many times after an initial upper respiratory infection, which is usually viral, there can be a lingering post-viral cough, and that can last for weeks, even up to a month. However, there are certain circumstances and other conditions that can cause a chronic cough, such as acid reflux, seasonal allergies, which cause postnasal drip, and if you have underlying reactive airway disease, such as asthma or COPD, that cough could signify bronchial inflammation, which would warrant an inhaled steroid or an oral steroid. So I think it's best to discuss the treatment options with your primary care provider, because they would know your individual risk for having other causes for that cough.